Scene script. Have you ever wondered how a drug gets from the pill you swallow to the site where it's needed in your body? That's where drug distribution comes into play. This isn't about distributing drugs from the pharmacy to your medicine cabinet, but rather the journey medicines undertake once they've entered your bloodstream. It's an invisible voyage, a physiological odyssey that determines how effectively a drug can do its job. Drug distribution refers to the process by which a drug is delivered from the bloodstream to the tissues and organs of the body. It's a critical journey that determines the effectiveness of the drug and even its potential side effects. From the moment you pop that pill or receive that injection, your body becomes a complex network of highways and byways for these medicinal travelers. Now let's delve deeper into the factors that affect this fascinating process. One crucial element in drug distribution is the volume of distribution. But what does this mean? The volume of distribution, often abbreviated as VD, is a concept that might seem complicated, but it's truly fascinating. It's described as a hypothetical or theoretical volume that would be necessary to contain the total amount of an administered drug at the same concentration that it is observed in the blood plasma. This doesn't necessarily correlate to any actual physiological volume, but it's an essential concept in understanding how a drug will behave once it's in the body. Picture this. You have a drug and you introduce it into the body. The drug, being the adventurous little molecule that it is, begins to explore. It travels through the bloodstream, visiting various tissues and organs. The volume of distribution is a way of quantifying this journey. It gives us an idea of how extensively the drug has distributed itself throughout the body. But why is this important? Well, the volume of distribution influences how much of the drug actually reaches its target site. Drugs with a high volume of distribution tend to distribute more extensively within the body, reaching more tissues and potentially having a broader impact. Conversely, drugs with a low volume of distribution may remain more concentrated within the bloodstream and may not reach as many tissues. For example, consider two drugs, one with a high volume of distribution and one with a low volume of distribution. If both drugs are administered at the same dose, the drug with the higher VD will be more diluted throughout the body, resulting in a lower concentration in the plasma. This could potentially affect the drug's efficacy and duration of action. So understanding the volume of distribution can provide vital information about a drug's journey within the body, how it will interact with various tissues, and how much of the drug will reach its intended target. So the volume of distribution plays a key role in drug distribution, but what other factors are at play? Did you know that our body has built-in barriers that can affect how drugs are distributed? Yes, it's true. These are known as physiological barriers, and they can often dictate the efficacy of a medication. Let's delve into a few of these barriers to better understand their role in drug distribution. Firstly, we have the blood-brain barrier. This acts as a gatekeeper, protecting the brain from potentially harmful substances. It's made up of tightly packed cells that form the walls of brain capillaries, which control what gets in and out of the brain. This barrier is highly selective, allowing only certain substances to pass through. As a result, many drugs can't cross this barrier, which can be a significant hurdle when developing treatments for brain-related conditions. Next up is the placental barrier. This is the barrier between a mother's blood and her developing fetus. It's designed to protect the fetus from harmful substances in the mother's bloodstream. However, this barrier is not completely impenetrable. Some drugs can cross the placental barrier and potentially harm the unborn child. Therefore, a drug's ability to penetrate this barrier is a crucial consideration in prescribing medications for pregnant women. Another important physiological barrier is the gastrointestinal tract. Drugs taken orally must survive the highly acidic environment of the stomach, then pass through the intestinal wall to reach the bloodstream. Some drugs can't withstand this journey, limiting the options for oral administration. It's also worth mentioning the blood testis and blood-ocular barriers, which protect the testes and the eyes respectively. Like the blood-brain barrier, these are highly selective, preventing many drugs from reaching these areas. As we can see, our body's own defenses can impact drug distribution. They can prevent medications from reaching their target sites, affecting their efficacy. But these barriers are not the only things that influence how drugs are distributed in the body. There's another important factor to consider: plasma protein binding. So stay tuned as we dive into that topic next. Scene script. Drugs don't just float freely in our bloodstream. In fact, many of them bind to proteins. But why does this matter? Well, let's dive into the fascinating world of plasma protein binding. Imagine the bloodstream as a bustling highway with vehicles of different sizes and speeds bustling about. Now consider the drugs as passengers. Some of these passengers prefer to travel alone, while others hitch a ride with protein vehicles. This binding to proteins is what we call plasma protein binding. In the bloodstream there are several proteins, but the most common one that drugs bind to is known as albumin. It's like the popular taxi service of our bloodstream. However, it's important to understand that when a drug is bound to a protein, it's essentially inactive. This is because only the unbound or free drug can cross cell membranes to reach its site of action and exert its pharmacological effects. Think of it this way: the drug, when bound to a protein, is like a passenger inside a locked car. It can't get out to reach its destination until it's unbound. So the proportion of drug that remains free or unbound is crucial. Now you might be wondering, what factors influence this binding? Several factors come into play, including the concentration of the drug, the type and amount of plasma proteins, and the drug's affinity or liking for the protein. For instance, if two drugs have a strong affinity for the same protein, they might compete for binding sites. This can result in more of one drug being unbound and hence more active. This is why it's essential to consider plasma protein binding when determining drug dosages and predicting drug interactions. Moreover, certain conditions like malnutrition or liver disease can reduce protein levels in the blood, altering drug effectiveness. This is yet another reason why understanding plasma protein binding is so critical in pharmacology. So, plasma protein binding can significantly impact the distribution and effectiveness of drugs. It's a complex yet fascinating process, much like the intricate dance of vehicles and passengers on a bustling highway. So we've learned a lot about drug distribution today. Let's recap. In the world of pharmacology, drug distribution is a vital concept to grasp. It's the process that happens after a drug enters our body, taking a fascinating journey through our circulatory system to reach its destined site of action. The journey isn't as straightforward as it might seem, as it is influenced by numerous factors. One of the key aspects we explored is the volume of distribution. This isn't about the physical space a drug occupies, but rather a theoretical concept that helps us understand how a drug spreads around the body. It's a crucial determinant in estimating the loading dose of a drug and understanding its pharmacokinetics, which is the study of how our body affects a drug. A high volume of distribution indicates that the drug is extensively distributed into the tissues, while a low volume suggests that the drug primarily stays within the bloodstream. But the journey of a drug isn't always smooth sailing. There are physiological barriers that can affect drug distribution. The blood-brain barrier, placental barrier, and blood-testis barrier, among others, function as a gatekeeper, regulating what substances can pass through and reach particular regions of the body. These barriers can significantly influence a drug's effectiveness and are therefore critical considerations in drug design and administration. We also delved into the plasma protein binding of drugs. It's a bit like a game of musical chairs. When a drug enters our bloodstream, it can remain free or bind to plasma proteins. The bound drug acts as a reservoir, slowly releasing the drug over time, while the unbound drug is free to exert its effects. The degree of this binding can impact the drug's distribution, half-life, and ultimately its therapeutic effect. So why does all this matter? Why do we need to understand volume of distribution, physiological barriers, and plasma protein binding? Well, they're not just theoretical concepts. They're the building blocks that help us understand how drugs work in our bodies, how they reach their target site, and how they're eventually eliminated. Understanding these factors allows pharmacologists to design more effective drugs and personalized treatment plans, improving patient outcomes. In conclusion, drug distribution is a multifaceted process influenced by many variables. Grasping these concepts can make the difference between a well-tailored treatment plan and a less effective one. The complexities of drug distribution remind us of the intricate balance our bodies maintain and how even small alterations can have significant impacts. Thank you for joining us on this journey through drug distribution. Remember, the more you know, the better equipped you are to understand the complexities of pharmacology. Subscribe for more, because you won't find me later.